Hello, this is Dr. Bob, Anthony, and Casey and DeMaria with another half of health for you. And tonight, we're going to talk about some very serious information. Do you know what the #1 cause of death in America is? Heart disease. Can you imagine that? Do you know that 95% of nearly every chronic condition that we are plagued with is directly due to personal lifestyle? So we're going to talk about the heart. I'm going to give you a little bit of physiology, and then we're going to talk about some of the tools that we use. The heart is a pump, literally located right about here in the left side of your chest. The heart beats around 100,000 times a day, 72 beats per minute. If you exercise, which I would implore all of you to exercise at least 150 minutes per week, when you strengthen the heart muscle, the magnitude of the heart and the rate of the heartbeat goes down. So it's more effective, more efficient, less times. You'll live longer. There are 4 chambers to the heart. The top chamber on the right is where the blood comes back into. And the reason I'm bringing that up is the blood flows up through your legs, through your liver, on the way to your heart. So it enters the right side of the heart on the upper chamber. That's why you want to sleep on your right side, because the blood flows back gradually and it reduces your chance of having a potential heart attack in the evening time. I just made a very important and significant statement. The liver. We talk about the liver almost as much as we talk about the spine and subluxation in our practice, because the liver is a very important organ. The liver, or the oil filter in your body, is located right about here. The blood flows through your liver on the way to your heart. The heart goes lub-dub. The lub-dub is when the valves close and they make a noise or they make a sound. Well, when patients come into our office, we have the technical ability, now listen to how I'm going to term this to you, to take a snapshot of the nutritional assessment of what's going on inside of your body. So this is not a diagnostic tool. It's a nutritional assessment of how your body's doing. And Dr. Kaysen is going to explain to you this unit that we have called an acoustic cardiogram and exactly how it works inside of your body. So Dr. Kaysen.
The acoustic cardiogram is just one of the tools that we have in our office to take a snapshot picture of how your heart is functioning. So what we do is we place this around the chest, and we're able to listen to your heart. It converts the sound energy into mechanical energy. So out on the graph you see here, we're able to see if there are any types of nutritional deficiencies in your body. For example, some people we've found that have had B vitamin deficiencies. Liver, they may need liver support. Also, adrenal fatigue and adrenal stress has been huge with the closing of the gaps and the lub-dub of how the heart should sound. So this has just been a great tool for us to get a deeper understanding of what exactly is going on inside of the heart.
And so what's really phenomenal, because we've been using it in our practice for years and years and years, we have mentioned in programs in the past that people who cry easy need B vitamins. We know that you need B vitamins to process estrogen. So as Dr. Kaysen was telling you, that the heart, when it closes and makes this valve noise, as insignificant it might sound, this electronic stethoscope is so sensitive, it could literally, what we see in the pattern is a widening of the graph. So when that valve closes, see, muscles contract and cause the valve to close. If the muscle does not have enough B vitamin because you're under stress or you've been eating too much sugar, the valve is going to close slower. And so the electronic stethoscope is going to show more of zigs and zags. It's going to be a lot wider. So we supplement our patients with B vitamins, and that B vitamins helps increase the magnitude and the efficiency of the heart sound. I mentioned to you in the first part of this segment about the liver. See, the blood flows through the liver on the way to the heart. If the blood flow is impeded on the heart graph, we see a little hump. we see a little hump. So the heart valve closed, but if it's impeded, we see the zigs and the zags, but then we see this little hump where the blood is really slowed down. What I found from my experience that most heart disease today is actually very common in individuals who have compromised liver function. So we know that we need to work on this liver and the B vitamins. And before I turn this over to Dr. Anthony, what I want to share with you is one other thought. If there's a lot of static on the graph, I know you're not absorbing minerals. And I know you're not absorbing minerals because you may be eating too much wheat. Wheat, rye, barley, and oats. Wheat, rye, barley, and oats have gluten in it. Gluten is glue. When you're passionately addicted to going out and having sandwiches, whether they be at a franchise that's telling you could lose weight or otherwise, or eating some kind of magic bread, that gluten will literally cause a coating inside of your intestines. Your body's not able to absorb minerals. It shows up as static on the heart graph. So we're not doing a diagnostic tool. This is not a diagnostic tool. If you want to go have your EKG and other tools, that's fine. But in our practice as wellness chiropractors, drugless doctor, this is a very unique tool, and we do very unique assessments. They're not diagnostic in the sense of a diagnosis, but it allows us to create a program of wellness for you, specifically designed for you. The miracle of this is that I had a gentleman who had his gallbladder out in 1994. When he had his gallbladder out, it was altered fat metabolism. Well, we could pick up on the acoustic cardiogram. But then what happened to him after he had his gallbladder out, he had heart attack, he had heart disease. So we can use this piece of equipment, which is a very unique piece of equipment, that we could help take a snapshot of what's going on inside of your heart. So I want to segue this to Dr. Anthony because, see, we have a chiropractic practice, but we also know the information goes from the brain, down the spinal cord, to your heart. So we are passionately trying to educate you that this is so significant, that this is true. What we're sharing with you now, this is so cutting edge, true wellness. And we're here to make a difference in your life. Dr. Anthony, you want to talk about subluxation and the nervous system?
Sure. So one of the things that's really, really important, and we are always educating our patients, is that the nervous system controls all the functions of your body. So the brain is constantly communicating with your body every single day, 26 billion text messages and emails to all the organs and tissues of your body. So I'm going to use this tool here to help me describe a little bit about what's going on there on the inside. And you can say, yes, he is holding a circuit breaker, and this is going to become a little bit more clear for some of you guys who learn in a different manner. So if I were to go to your house and I was to turn off the circuit breaker to your refrigerator, what would happen to the food in the refrigerator? For all of you who are already raising your hands, I know that you would say, well, the food would go bad. And I say, you were one of those smart students. You get a gold star on your forehead. So the same principle applies to your nervous system. We are subluxation detectives, and those bones that are out of alignment cause pressure on those delicate nerves that are communicating with the brain. So just like this circuit that I'm holding here goes to the heart, if that vertebra is out of line or subluxated, it can be causing pressure there to your heart. You might have a heart palpitation, you might have increased blood pressure, all of which have been shown through research studies to respond favorably to chiropractic care. One of the things that's really important for me is one of the reasons that I decided to become a chiropractor was I saw one of our existing patients that still comes in to this day. About 8 years ago, we had done an exam on him with an x-ray, and we were able to see that the size of his heart was enlarged when he first came into the office. And through a series of spinal adjustments and removing his physical subluxations in his body, we were able to take a post x-ray and find that his heart reduced back to the normal size. So that was my light bulb experience for understanding how the brain communicates with the body and it heals itself. So one of the things that I want you to think about is taking care of what you already have, because you might think, well, they do have heart transplants, but have you ever heard of a spine transplant? You can't transplant your spinal cord and your nervous system because it's the control center. That's why we are nervous system detectives.
That's awesome. You want to grab that spine and let's show this like this. I think what I really want you to also take it to the next level, and we're going to be talking about on the second segment, so you're going to want to come back because this is cutting edge that we're sharing with you right now. As Dr. Anthony was relating to you, is that these segments right here, you know, you have people who start having numbness in their left arm. Well, there's a nerve that goes down to the lower cervical, upper thoracic that has innervation to the nerves that go to your heart. So that numbness overflow that you're feeling into your arm is actually coming because the heart is distressed. We also know that people can have fatty hearts. You have fatty livers. So if you are overweight, ladies, your waist should never be greater than 35 inches. Gentlemen, your waist should never be greater than 40 inches. When your waist is greater than those numbers, it's putting extraordinary stress on the heart. Well, we have the ability through spinal x-rays that we can look at the vertebra on the upper part of your spine, and there are patterns. We know that a spine, mechanically, if you're working in a drill press somewhere and you're always constantly going down, the vertebra will shift to the side that you've been doing all of the pulling down. But let's just say that you have a poor diet. That poor diet to us includes eating sugar and trans fat, high fructose corn syrup, and wheat products, especially genetically engineered products. That will create distress to your pancreas and to the other organs. So the pattern up here in your spine will have what we call a pathobiomechanical lesion. Dr. Bob, those are big words. They are big words, but we're able to determine, we're able to detect by looking at films the alignment. So I'm going to give you some new information. If you eat sugar, that sugar can cause what we call a visceral somatic, this is college level vocabulary, a visceral somatic pathobiomechanical subluxation. You should just be able to come to see us just because of our ability to articulate those words. That visceral somatic pathobiomechanical subluxation, in other words, a bone is out of alignment, is putting pressure on nerves directly caused by the sugar that you've been eating. Now, this was a very important segment. You're going to want to go on the internet and look up Dr. Bob Anthony and Kaysen and heart and the acoustic cardiogram and watch this over again because we're trying to save your life. We're going to take a short break and we're going to be right back, and we're going to talk about how posture impairs function and could literally cause COPD, the new epidemic that's crossing America. Be right back. Hello, this is Dr. Bob Anthony and Kaysen DeMaria, and I'm standing in front of a posture zone because what we're going to talk about in this segment is we're going to talk about how important your posture is. So after our program today, not while we're talking, but after the program, what I want you to do is I want you to take a digital picture of yourself, and I want you to look at your head. Is it tilting off to the left? Or is your shoulder high on the left-hand side? Is your trunk shifting off to the side? Because if it is, your posture is off, but when your posture is off, your spine is off. When your spine is off, your nervous system is off, and you're not going to function optimally. This is very serious. What I'm holding in my hand right now is a skull inside of a bowling ball, and as I turn my body off to the side here, this bowling ball right here should be directly over your shoulder like this, and for every inch that your head goes forward, it increases the weight of your head by 10 pounds. We've had patients come into our office that heads have weighed up to over 100 pounds. The head itself does not increase in weight, but the physics of that does. For the average head weighs 10 or 12 pounds. For every inch that your head is forward, it increases the weight of the head 10 or 12 pounds. What you want to do is you want to make sure that you're working on your posture. I'm going to encourage you to come into our office because Dr. Anthony is holding a computerized posture assessment that we make available to our patients. We do this also when we go out to speak to companies, businesses, and organizations. And we can do this to you also. So with this posture assessment that he's holding in his hand right now, We can literally look and mark vector points and tell you which way your head is shifting, left or right. And I think that's really important. And what we have found from our experiences is that you could have conditions like COPD and asthma that all can happen because of decreased posture as your head is going in a forward position. Now, Dr. Kaysen right now, she is holding in her hand a plastic model of the spine. And this is what I need you to get. Just show Dr. Kaysen, bring that back up just a bit. Show them, yeah, that's good. Talk to them about what we're seeing in our practice with heads going in a forward position.
So as you saw with Dr. Bob, when you're standing at your side, what you should see is your head should be over your shoulder, which is over your hips and your knees. Everything should be in a nice line. What we're seeing is an epidemic of people that have their heads forward due to computer games, video games, cell phones, their occupation. They're sitting at a desk for hours typing. Also things like purses, backpacks, all of these things alter your posture. So if your head is forward 4 or 5 inches, that could be an extra 50 to 60 pounds of pressure that you're putting on your lungs, your heart, breathing, things that you don't think about during the day. But you also could be having knee pain or low back pain because of how far your head is going forward. This is because the pelvis wants to go underneath your neck to support the center of gravity. This is all due to the subluxations in your neck. So a lot of people, they don't understand that your posture is very significant because you can't just correct your posture by exercises. If you were to do nothing about the structure in your spine, you're just going to continue to go forward because how gravity is always pushing on you.
So what we have learned, and what we also have the ability to do in our practice, is we have the ability to take and do a spirometer assessment. So when you breathe out your forced vital capacity, as Dr. Kaysen was showing you, and research has shown, if you're in a slumping posture, you can reduce your oxygenation by 15%. Do you hear what I just said? So if you're sitting in your slumped posture, your amount of air is reduced by nearly 15% from a normal sitting posture. And Dr. Anthony, you want to grab that atomizer right there? We know that right now the #1 cause for people to go to the emergency room happens to be asthma.
So one of the things that's really powerful is getting kids and adults off of these drugs by doing spinal adjustments to bones that are out of alignment and improving posture. And one of my favorite things is when someone comes in the office after a period of time, we're going to do an update of their posture and they get to see for themselves how much they have improved over time being in the office, that the light bulb goes on in their head and they say, oh my gosh, I can see the huge changes that you guys have already been making. And that's really awesome that we're able to show them that. We're also using the spirometer as a tool for lung function because as you get older and you're coming forward, you're compressing your lungs. And that oxygen that's so important for us to stay alive isn't as good as it could have been because of your posture. So another thing that we've been doing with the spirometer, which is so important with conditions like COPD and people that are smoking, is we have the ability with the spirometer to figure out the age of your lungs.
I think you need to say that again because that's really huge.
With the spirometer, we have the ability to figure out the age of your lungs via normalization curves and the measuring of that spirometer, that data that comes out of that. We can actually tell somebody how old their lungs are. We recently had a 44-year-old gentleman who is a smoker, and we had him do the spirometer assessment, and the data for his lung age was over 90. He about crapped his pants. And I said that in love because he decided that that was his come to Jesus moment, that he was going to stop smoking because he knew that if he didn't make appropriate changes that his life would be shortened because of his postural deficiencies and the smoke that he was putting into his lungs.
You know, I'm excited just thinking about everything that we just said because I don't know if you understand the technology. we have the ability that we can take a temperature picture of your spine. It's called thermography. This is like so CSI. And then we have the ability with a computerized posture assessment that we could tell you how much your head weighs. What happened to myself personally, I had a lady that's been a patient of ours, and she came into the office, and she was very concerned because she was, let's say, 50-ish years old, and her mom had COPD. COPD is the new condition that's going on right now, chronic obstructive pulmonary disease. Her mom had shrunk 4 or 5 inches. She brought her graph in and she showed it to me, and I thought, oh Lord, we have to do something about this. So that's why we invested. That's right, we invested in a spirometer. We have patients of ours that are respiratory therapists that helped explain to what's going on. We've done research. We have classes in cardiac physiology. We've had classes in respiratory physiology. So we understood how it was. But it was this huge epiphany that the Lord gave us this divine insight that said, if a person's posture is slumped, it reduces airway movement, which reduces oxygenation, which means people are going to get exactly what Dr. Anthony just said. They're going to get asthma and COPD. But not only that, when your posture is forward, like Dr. Kaysen said, you could have what we call carpal tunnel syndrome. If you have carpal tunnel syndrome on both sides, or bilateral carpal tunnel, and you've had the unfortunate mishap of somebody talking you into get surgery already, and we've had people who have had 2 wrist surgeries to both wrists. I had one lady that had 10 operations, releases in her arm alone. This is serious business, and we're here to make a difference for each and every one of you. You could have chronic headaches and fatigue and lung problems. You can have low back pain. You could have your golf game could be interfered with. Your whole life could be impaired because of poor function. And when we have patients that come in, and we see that they have respiratory distress, we will make that decision if the spirometer is an answer for you. When you come into the office and you have a family history of heart disease, if you're overweight, if you have high blood pressure, we will be making that wise decision if we should do the acoustic cardiogram for you. Now here's an epidemic that's occurring in our society today. It's called techno-neck. See, you have 2 or 3 and 4 or 5-year-old children that are doing this already. I want you to stop and realize what you're doing. What you're doing is almost child abuse. See, that's pretty bold, Dr. Bob. Think about what I'm saying. As the twig is bent, the tree will grow. If you continue to let your child be like this, their posture will be permanently impaired. Right now, the fast food industry, the breakfast cereal industry, they're minimizing their advertisements on TV. You know what they're creating? They're creating apps. They're creating apps for your kids to play on smartphones. They estimate right now there happened to be one breakfast cereal that sold or released one of their apps. 8 million people downloaded this app. And I've seen pictures in business magazines of these kids' postures like this. There's research articles from all over the world that is showing that if your spine is forward, it restricts airflow. Do you want to know what else? Research has shown that if your thoracic spine or your mid-back region is not functioning optimally, it's going to reduce airflow. Are you missing work? Do you know the #1 cause for people to go to the emergency room? Asthma. Do you know the #1 drug that kids take under 21 years old? It's asthma. Do you know what the #1 cause of accidental death is in the United States? It's prescription medications. This is a serious battle that we're in, and we're here leading the pack. We're here revolutionizing